Hello everyone and welcome back to another anatomy video. In this anatomy video we will talk about the anatomy of the skull of the dog. So let's get started. Okay, as you can see here we have the skull of the dog. So we will go through the different structures of the skull and the mandible, of course. So we will explain how the mandible and the skull are, articulate to each other, and in general we can divide the bones of the skull, which are there to give or to form the framework of the skull and to protect the internal organs or the organs which we can find inside the skull, including the brain, including the sense organs like the eyes, for example, and ears, and so on. So we can divide these bones into two groups: the bones which are there to form the cranium or the cranial cavity. The cranial cavity is the place where we have the brain, of course. So where can we find the cranium? So if you look at this big foramen here, the foramen magnum, and where, of course, the spinal cord leaves the brain into the vertebral canal. So here through the magnum foramen we can go to the cranium or to the cranial cavity. So the cranial cavity is located inside here. So the first group of bones are there to form the cranium or the cranial cavity, while the second group is there to form the framework of the face, and that's why we will name them here as facial bones. And the bones which are there to form the cranial cavity are the cranial bones. And now, to be a little bit organized, let's start by talking about the bones which are there to form the floor, for example, of the floor of the cranial cavity. Here, from caudal to rostral, we have the base occipital bone. This is the base occipital bone. After that, here we have the base sphenoid bone, and finally this three angular structure found in this area is the presphenoid bone. So the base occipital bone, the base sphenoid bone, and the presphenoid bone, they are there, they are all unpaired bones, single bones, to form the floor of the cranial cavity. Let's move now and look at the caudal wall of the cranial cavity. In the caudal wall, or in another word, we can name this wall here as a knuckle wall. In the bones which are there to form the knuckle wall or the caudal wall is actually the different parts of the occipital bone. So this all is the occipital bone, consists of the base occipital bone here. This is the base occipital bone, base including the condyles, occipital condyles, and the base occipital bone. We have the lateral part. This is the lateral part of the occipital bone, including the paracondylar processes. And we have here the squamous part of the occipital bone. So the squamous part, this part of the base occipital bone, and the lateral part of the occipital bone are there to form the caudal wall or the knuckle wall of the cranium or cranial cavity. If we move to the lateral view or lateral surface, here we can find the temporal bone. The temporal bone, this big bone, all of this here, including the tympanic polla, for example, in this process here, the zygomatic process of the temporal bone. So the temporal bone is there to form the lateral wall of the cranial cavity. The lateral wall of the cranial cavity. And it's, of course, paired bone. That means we have one on the right side and one on the left side. So now let's move and look at the roof of the cranium or cranial cavity. In this case, we have caudally here a small bone here called the interparietal bone. We have here paired parietal bone, left and right. This is the parietal bone, and rostrally here we have the frontal bone is also paired. So frontal bone, parietal bone, and the interparietal bone are there to form the roof of the cranial cavity. The name of the interparietal bone comes actually from its location, because this bone here, I hope that you can see the suture here. This is the suture, so it's just, you know, what I can hold here. This is the interparietal bone. This is the interparietal bone. It's located exactly between the two parietal bones, and that's why its name is interparietal bone. Interparietal bone. Okay. What else? So we talked about the floor, we talked about the roof, we talked about the caudal wall of the cranial cavity, and we have just the nasal wall or the rostral wall. Nasal wall because it's the wall which is located, you know, toward the nose. The bone which forms the nasal wall of the cranial cavity is called the ethmoid bone, but it's something we cannot see from outside, so we have to open the skull to see the ethmoid bone, which is located normally at this level here and forms the rostral wall or the nasal wall of the cranium or of the cranial cavity. Okay, so we can also here, of course, see some of the facial bones, including the frontal bone. We mentioned the frontal bone firstly here. In the dorsal view, we have the nasal bone here. The nasal bone is paired. We have a little bit laterally here, we have the maxilla. The maxilla is this very big bone, you know, this very big bone, which includes, of course, the alveolar processes to hold the premolar and molar teeth. We have the incisive bone here. I'm going just, you know, quickly through the bones, and after that we will talk in details about them. Here we have the incisive bone is also paired. It's also paired. The incisive bone has the alveolar processes to hold the incisors. So this is the left and this is the right incisive bone. Here in the lateral view we have also the zygomatic bone. This bone here is the zygomatic bone. The zygomatic bone. Look at this skull here. Of course, some of the bones are painted, you know, that's why we can see the borders of these bones. Here we have, for example, again, so here we have the zygomatic bone with its process here, the temporal process of the zygomatic bone. Here in this area we have the lacrimal bone, and yeah, okay, the maxilla is highlighted in green here. The the light green is the incisive bone here in this case, and we have here the nasal bone again. Okay, so let's move the skull here and look at the ventral surface of the skull. Here we can see the maxilla. This is another part of the maxilla, of course. This part of the maxilla, left and right, called the palatine process of the maxilla. Here we have the palatine bone. The palatine bone, it's more clear in the other one. Let's go to this one again, I think. Okay, so here we have the palatine bone. Yeah, here we can see the suture between the palatine bone and the maxilla here, this area here. So the palatine bone itself has two parts, you know. This is the horizontal blade. This is the horizontal blade, left and right, of course, horizontal blade of the palatine bone, and on the side here we have the perpendicular blade, the perpendicular or vertical blade, you know, perpendicular blade of the palatine bone. Here we have the pterygoid bones. What else? Okay, now I would like, you know, to mention the extra structures which we can see, you know, in all views of the skull. And let's start actually with the dorsal view. Here in the dorsal view we have the Sagittal crest here. This is the sagittal crest. Is formed between the two parietal bones. Sagittal crest. If you follow the sagittal crest at this point here, it's somehow divided and moves laterally here and there. And these two lines here and there called the temporal lines, because they will form somehow the rostral border of what's called here the temporal fossa. So this area here is the temporal fossa. This area is the temporal fossa. The temporal fossa is the place where we have the temporal muscle originate from here, from the external surface of this fossa here, and inserts, of course, of the coronoid process of the mandible. Okay, so sagittal crest. This is the sagittal crest, and here we have the temporal lines. Okay, good. In this view, we have also, let's go to this side here. We have here from the temporal bone, we have the temporal crest. This is the temporal crest, which is, if you follow the temporal crest here, you will find, this crest here called the knuckle crest. This is the knuckle crest. Okay, knuckle crest. So here we have the temporal crest. So don't mix between the temporal crest and the temporal line, please. Good. In the lateral view here, here on the side we have this structure called the zygomatic arch. The zygomatic arch is formed by two processes. The first process belongs to the temporal bone. The second process belongs to the zygomatic bone. But because of the direction of these processes, so this process here is directed toward the zygomatic bone. That's why we will name it zygomatic. Here we're talking about the zygomatic process of which bone? Of the temporal bone. Zygomatic process of the temporal bone. Vice versa, this process called in this case the temporal process of the zygomatic bone. The temporal process of the zygomatic bone. Both processes meet together here to form what's called the zygomatic arch. The zygomatic arch, forms part of the orbita here, as you can see. In other animals, you will find that the orbita, this place here, the place where we have the eye, for example, is closed here, is closed completely, like that one of the horse, camel, for example, ox, for example. So in carnivores, this orbita is not closed, is open in this area. Here from the frontal bone, we have another process. This process here, it's directed toward the zygomatic bone. That's why we will name it as zygomatic process of the temporal bone. Zygomatic process of the temporal bone. So should we go through them again? Here we have the the zygomatic process of the temporal bone. Zygomatic process of the temporal bone. This one here is the temporal process of the zygomatic bone. And this one here is the zygomatic process of the frontal bone. Okay, good. Let's move a little bit rostrally here. In this view here, we can see the maxilla again. The maxilla, and as we described before, we have from the maxilla what's called here the alveolar processes, the place where we have the premolar and molar and the canine, for example, here. Alveolar processes, and more rostrally here we have the incisive bone. The incisive bone itself has a wing. This is, let's go to this view here. We have the wing of, or the body, let's say, this is the body of the incisive bone, where we have the alveolar processes for the incisors, and from the body here toward the nose, follow me please here toward the nose. Here we have what's called the nasal process of the incisive bone. This is the nasal process of the incisive bone. It's very long, yeah? Reach this point here. The nasal process of the incisive bone. Good. If we move to the ventral surface, so let's move to the ventral surface, and as you can see here we have a lot of structures which we can talk about. And let's continue here in this area. Of course we have the incisors here, we have the canine, premolar and the molar teeth. Here in this area we can see the bony structure or bony components of the hard palate. So this is the bones which are there to form the hard palate, including firstly the horizontal plate of the palatine bone. So this is the horizontal plate of the palatine bone, here, left and right of course. We have here from the maxilla, this one is the palatine process of the maxilla, the palatine process of the maxilla, left and right of course. And from the incisive bone here, these two small processes, let's go and look at them. These two small processes, left and right, called the palatine process of the incisive bone. Palatine process of the incisive bone. So again, the horizontal plate of the palatine bone plus the palatine process of the maxilla and the palatine process of the incisive bone, they form together the bony component or structure of the hard palate, and after that of course these bones are covered with a mucosa to form the hard palate. Good. Here of course as we are here we have the opening from the nose toward the pharynx, the choana opening is here. If we go back here in this area, let's focus a little bit on this area here. Caudally here we have the two condyles of the occipital bone. Two condyles of the occipital bones called the occipital condyles are there of course for the articulation. So for the articulation with the cranial articular processes of the first cervical vertebra or C1 or the atlas, okay? So occipital condyles. Between the two occipital condyles we have this big foramen, the biggest foramen of the skull, called the foramen magnum. Foramen magnum or the magnum foramen. A little bit rostrally here. Let's go through all structures. The biggest structure first, and after that we will move to the next. Here we can see these two very big structures called the tympanic polla. Tympanic polla, belongs to the middle ear, of course, where we have the ossicles, the small ossicles of the middle ear. The tympanic polla. Good. Of course, here from the tympanic polla, this big opening in this area here. Sorry, just a minute. Sorry. This big opening here to the tympanic polla is the external acousticus meatus. So the external acousticus meatus is here. Okay, connect the external ear to the middle ear. External acousticus meatus. Okay, what else? Here next to the tympanic polla we have this process here called the mastoid process, here, and we have of course here in the caudal view it's better to see the occipital condyles, and next to the occipital condyles, left and right, here we have these two big processes. So they are the paracondylar processes, or in some books they name them as jugular processes, or para next to paracondylar process. Okay, good. Paracondylar process. Here the mastoid process is extremely important for muscle attachment. Here In this area you can find left and right, of course, two smooth surface in fresh apparatus. For example, it's covered with articular cartilage. This surface is for the articulation with the mandible, and they are called the mandibular fossa. The mandibular fossa, the articular surface, as we mentioned before, with the mandible. So the mandible, that part of the mandible here is the condylar process are there for the articulation with the mandibular fossa, as you can see here. So let put it in the correct position, just like this. So let's put them together here. As you can see, we can see how the condylar process of the mandible articulates with the mandibular fossa of the skull here to form the jaw joint, or the temporomandibular joint. Temporal, because this part here is part of the temporal bone. So temporomandibular joint. Temporomandibular joint here, and between them, of course, in live animals we have like a disc, like a fibrocartilaginous structure here to get the shape of the two components of this joint. Okay, let's go back to the skull again. We named this area here as the mandibular fossa, left and right. Behind the mandibular fossa here we can see this projection here and there. This is the retroarticular process. Retroarticular just because it's located behind the articular surface. So retroarticular process, just good news for all of us that there is a foramen located in this area here. Let me in this area. So this foramen here located just behind the retroarticular process, called also the retroarticular foramen. Behind the retroarticular process. So from rostral to caudal we have the mandibular fossa, the retroarticular process, and the retroarticular foramen here. Good. What else? Next, or medial to the tympanic polla here and there we have the muscular tubercle. For attachment, for muscle attachment. In this case, we for the attachment of the rectus capitis muscle. And what else? Now here we have the hamulus, for example. These two processes here and there. This one here. Here in the caudal region here, we have firstly in the ventral view, of course, in front of the condyles or the occipital condyles, the two foramens which we can see here and there are the hypoglossal foramens. Hypoglossal foramen, the exit place of the hypoglossal nerve, which is the cranial nerve number 12. Hypoglossal foramen. Next to it and behind the tympanic polla, these two big foramina here are the jugular foramen. The jugular foramen is the exit place of the cranial nerve number 9, number 10, and number 11. Number 9, glossopharyngeus. Number 10, the vagus nerve, and number 11, the accessory nerve. Okay, if we move a little bit rostrally, we said, of course, that behind the retroarticular process we have the retroarticular foramen there, retroarticular foramen. Okay. In this area here, we have three main foramens. So the first one, which we can see here, let me just show you. So this one here is the oval foramen. So this is the oval foramen. This is the exit place of the mandibular nerve. Mandibular nerve is one or branch of the cranial nerve number 5 or trigeminal nerve. So the mandibular nerve go through or exit the cranium through the oval foramen. Next to the oval foramen at this level here we have two foramina. The first one, the medial one here, is the carotid foramen, So I just try to put this, into it. This is the carotid foramen here and there, the carotid foramen. This is the entrance place of the internal carotid artery, and here we have the spinous foramen. Okay, the spinous foramen is here and there. This is the spinous foramen again. So the three foramens we can see here are the oval foramen. We have the oval foramen. We have the carotid foramen. And we have the spinous foramen there. The spinous foramen. Good. Inside the orbita, inside this area here, and in the rostral part of the orbita, we can find another three foramens. I hope it's clear. So the first one here is the fossa for the lacrimal sac. The fossa for the lacrimal sac is the connection to the nasolacrimal canal, of course. Fossa for the lacrimal sac. And at this level here, we can see three foramina. I will try to show you. So the first one is located here. So the first foramen, the biggest one actually, is the maxillary foramen. This is the maxillary foramen. The entrance place of the maxillary nerve. Here at this level we have two foramina. So the first one, or the dorsal one, is the sphenopalatine foramen, and the distal one is the caudopalatine foramen. This one is the caudopalatine foramen. Okay. Now the question is, how can we differentiate between them? So if you're not sure which one is the maxillary foramen, just try to put something inside it. If you push something into the maxillary foramen, you will go or exit the infraorbital foramen here. So let's pretend that this one here is the maxillary nerve. The maxillary nerve enters the maxillary foramen. On the way, it gives a lot, of course, inside the maxilla, it gives a lot of dental branches to the teeth, and exit the infraorbital foramen here. And from here, the name will be changed, and it's called here the infraorbital nerve, which goes and gives a lot of branches to the facial muscles and to the incisors. Okay, so what about the other two foramina, which we can see at this level here? So we have the caudal palatine and we have the sphenopalatine foramen. So to be able to differentiate between them, try to push something inside the caudal palatine, and let's go to this one here. So the caudal, if we go through the caudal palatine foramen here, let's go this way. So caudal palatine foramen here, look. So you will exit the major palatine, the major palatine or the rostral palatine foramen here. Okay. So the major palatine artery will go through the caudal palatine foramen, exit here, and move rostrally. Okay. And if we go through the sphenopalatine, so go through the sphenopalatine foramen. In this case, you will go directly to the nasal cavity. Let's try to do something. Can you see? No? Can you see that? So we are inside. Look. We are inside the nasal cavity. And that's why how we can differentiate between them. In the caudal region of the orbita, here in this area here, we can see some other foramina. So the major three foramens which we can see here are, firstly, the first one here is the optic foramen. For the optic nerve, of course. The next one is the orbital fissure. And the last one here is the rostral alar foramen. The rostral alar foramen. Once we say rostral alar foramen, that means we have a caudal alar foramen here. So the caudal alar, if you go through the caudal alar foramen, look exactly, you will exit the rostral alar foramen. That's why between the caudal alar foramen and the rostral alar foramen, this canal called the alar canal. Actually, the maxillary artery go through the caudal alar foramen and exit the rostral alar foramen, while the maxillary nerve comes from the cranium and exits the rostral alar foramen here and moves toward the maxillary foramen. So alar canal is formed by between the caudal alar foramen and the rostral alar foramen. Okay, inside the orbita, so there is another very small foramen located in this area here. This is the ethmoid foramen. This is the ethmoid foramen. Ethmoid foramen. Okay, what else? We talked, let's one more time, behind the caudal alar foramen. Here we say that we have the oval foramen. Next or behind it there are two foramina. The medial one is the carotid foramen. The carotid foramen is this one here, and the next one, the lateral one, is the spinous foramen. Behind the articular process we have the retroarticular foramen. The retroarticular foramen. Okay, and here we forgot just to mention actually the foramen located in all animals between the mastoid process and the styloid process, called the stylomastoid foramen. This foramen is the stylomastoid foramen. This is the exit of the cranial nerve number 7, or the facial nerve. In dogs there is no styloid process, and that's why we have just the mastoid process. Next to it here, in this case in the dog, between the mastoid process and the tympanic polla, we have the stylomastoid foramen here, exit place of the facial nerve. Finally, and before we finish, here in the caudal view of the skull, we can see left and right these two foramina here, called the mastoid foramen. Just above the mastoid process we have the mastoid foramen for the caudal meningeal artery. Okay, now let's talk about the anatomy of the mandible. The mandible, has two parts, of course, fused together or articulate with each other in this area here. In general, the mandible has like body and ramus here. So this is the body and this is the ramus. In this view here, we can see inside the body here we have the alveolar processes to hold the premolar and molar teeth of the lower mandible or lower jaw. Here we have the canine, and we have of course the incisors in this area here. If we move to the caudal part here, we can see that the mandible in this area has three processes. 1, 2, 3. This process here is the coronoid process, the insertion area of the temporal muscle. The next one is the one which has articular service here. This is the condylar process for the articulation with the mandibular fossa of the skull. And the last one here, located at the corner between the ramus and the body, called the angular process. On the lateral surface here we have this fossa, the place of the masseter muscle, called the masseteric fossa. Here. Medially, on the medial surface, as you can see here, we have a foramen called the mandibular foramen. Where the alveolar inferior nerve and artery move through. The alveolar inferior The inferior alveolar nerve is a branch of the mandibular nerve. It enters the mandible here and moves inside the canal found in this area, gives a lot of dental branches to the teeth, and exit the mandible through what's called the dental foramen. The dental foramen. Normally we have just one dental foramen, and in some breeds or in some other animals like camel for example, there are always two mental foramens. So the alveolar inferior nerve enter again the mandibular foramen, moves inside the body of the mandible, gives a lot of dental branches, exit the mental foramen, and from here it's called actually the mental nerve. The mental nerve, and from here the mental nerve gives a lot of branches for the innervation of the incisors and the canine. Good. That's everything. Let me just try to put the mandible to the skull one more time here. So as we said before, the condylar processes of the mandible are there for the articulation with the mandibular fossa. So we have to put them here exactly inside the mandibular fossa, and in this way here we can close the skull, as you can see here, like this. Okay, so the mandibular process articulate with the mandibular fossa there, while as you can see here the coronoid process is located here because it will form the insertion area of the temporal muscle, which is one of the mastication muscles. The temporal muscle originates from the temporal fossa here and inserts on the coronoid process, while here laterally on the mandible we have the masseteric fossa, for the insertion of the masseter muscle, which will start from the zygomatic arch. So that's everything about the anatomy of the skull of the dog. In the future we will try to look at the skull of some other animal species. Thank you very much and see you later.